Bismillahirrahmanirrahim. Iyyaka na'budu wa iyyaka nasta'in. Allahumma salli ala Muhammadin wa ala ali Muhammadin wa barik sallam wa sallu alayhi. Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. Today I am going to tell you how to trace the right ureter. As we know that ureter is a tubular structure and it is a muscular tube. Smooth muscles are present within the wall of the ureter. So these muscles contract rhythmically and then propel the urine, transport the urine from the kidney, from the renal pelvis, and then transport the urine to the urinary bladder. So here this patient is a 30-year-old with history of right renal colic. So when we are going to trace the ureter, as we know, if we cannot appreciate the ureter, it means that this ureter, right ureter, is collapsed. So very difficult to appreciate the collapsed ureter because its wall are less than 1 millimeter in diameter. So very difficult. Only we can appreciate the echogenic line if the ureter is collapsed. So when we are going to collapse the right ureter, patient should be in the lateral position, decubitus position, and the probe should be at laminocular position. Then we can appreciate here the dilated calyces, and then we should recognize the ureter. So 4 portion of the ureter. Number 1, pelvi-ureteric junction portion. So where the renal pelvis combined with the ureter, there is a turn, sharp turn, you can appreciate here. So this is the renal pelvis and it is making turn here, slight turn. This is the pelvi-ureteric junction. So this is the one portion, pelvi-ureteric junction, or PUJ portion. So when the best thing for the sonographer is, if the ureter is dilated, then it is easy to trace it. So this ureter is dilated, so we can easily appreciate it. So this is the PUJ and this is now the ureter in the upper abdomen. This we can see it proximal ureter. So in the decubitus position, we can only appreciate the PUJ, and very difficult to appreciate the proximal ureter in the whole abdomen. So this is difficult. So then we ask the patient to have a supine position. So we have seen this ureter up to this level. So as we know that the ureter is present medially from the renal pelvis and it goes downward anterior to the psoas major muscle. So I am going to ask the patient to adopt the supine position. So now patient is in the supine position. Here we will come across bowel gases which are also abundant here. So first the probe should be in the longitudinal direction and then making angle 90 degree with the floor, and then we can appreciate the psoas major muscle. Slightly give the graded compression so that the bowel gases should be displaced. So here we can appreciate the psoas major muscle. This is the psoas major muscle. So here should be the ureter because it runs anteriorly along the source major muscle. But when the probe is in 90 degree to the floor, we cannot appreciate. So then at this position, when the patient is in spine position and we are going to trace the right ureter, just tilt the probe or angle the probe slightly anteriorly and towards the left side of the patient or left, and so slightly angle it upward. When we will do this maneuver as I am doing, then we will see the vessels and then the ureter. If the person is fatty, it is difficult, but we can trace if the ureter is dilated. Over here we can appreciate this is the source major muscle, and I am angling the probe slightly upward, and then I have seen this ureter. This is the ureter, and also this black area, these are the vessels. So if we become confused that which would be the ureter, we can apply the color as I am doing. So the ureter will not take the color, as here we have seen, and these are the gonadal vessels which are crossing the ureter in the proximal ureter. So proximal ureter is also crossed by the gonadal vessels also. So we should not confuse the ureter with the vessels, and this difficulty can be overcome by putting the color. So when we have seen the ureter, then we drag the probe downward and follow the ureter. This is the ureter, dragging it slowly until we reach the level of the iliac vessels. So this is the one method to trace the ureter, proximal ureter. Another, we can ask the patient to adopt the prone position when we are going to trace the right ureter. So I am asking the patient to adopt the prone position. Patient has adopted the prone position. So here, then this is the kidney, and then again I have placed the probe at the lumbar region where the kidney is on the screen, and then this is the source major muscle. Now source will see anteriorly when the patient is in prone position. This is the source muscle, and here it should be. So then we tilt the probe slightly, angle it upward. Now look here. This is the turn PUJ, and this is the proximal ureter, and we can easily appreciate the right ureter. So this maneuver will only give benefits to trace the right ureter. We can try for the left ureter also, but this gives more benefits. This maneuver, this prone position, when the patient to trace the right ureter. So here we can appreciate that we can easily appreciate the proximal ureter in the upper abdomen. So this is the second portion. First was the PUJ portion, second is the proximal ureter. So then again we ask the patient to adopt the supine position to see the portion of the ureter while it is crossing the iliac vessel at the level of pelvic bed. So now we have reached the iliac vessel region. So then when patient in spine position, trace the iliac vessels and just give graded compression to displace the bowel gases. Bowel gases are present, so feeling difficulty. However, we can overcome the. Now look here, this is the iliac vessel, this is the iliac vessel, and this we can appreciate. This. Look here. This is the ureter, it is crossing it. Here it is crossing it. We can appreciate here. Ureter is coming from here. And then I have placed the probe at the iliac vessel level and slightly angle it upward. And here it is crossing. This is. And if you feel difficulty, we can put the color. So look here, these are the vessel and this is not the vessel, this is ureter. So I'm feeling easy because the ureter is dilated. However, we can also trace the ureter which is not too much dilated, only it is prominent, we can also trace it. So when we have seen that the third portion, which is the crossing point of iliac vessel, the ureter has crossed the iliac vessel and we are unable to find the stone, then in the pelvic area there is abundance of the gases due to the ileum, because the distal ileum lodge here is here at the pelvic region. So then we just put the probe at pelvic region to appreciate the urinary bladder. The urinary bladder should be optimally fit. This is very crucial for the tracing the right ureter. And then when we reaches the pelvic area, we should trace the PUJ. So here we can appreciate this portion. You look at here, this is the VUJ, which is the narrowest part of the ureter, and it passes obliquely through the wall of the urinary bladder and then enter into the urinary bladder at the trigone area. This is the trigone area, and this is the vesico-ureteric junction, and this is the nearest part. Here we can also appreciate this is the stone, very small stone here, maybe 4 millimeter, and this intramural part which has oblique turn into the urinary bladder helps the ureter and helps to prevent the vesico-ureteric reflux here. Look here, when we reach the we use and just tilt the probe again, angle it upward slightly to follow the, this is the stone, small stone, and this is the ureter. Look here, it is coming. And also give graded compression so that bowel loops gases should be displaced. Appreciate it. Bladder should be optimally fit. So here, this we can appreciate up to this level until the rectum is in the screen. So then again we will see this. So this is the VUJ, and this is this small is the stone which is not giving shadow. Also I have put the color, but this is too much small that it is not giving the twinkle artifact also. Again we can appreciate this is the ureter, here. This is a small stone which is trapped here. This one. This was all about how to trace the right ureter. Thank you very much.